Hello everyone, myself Dr. Sayyid Abrar. Today we will see the pleura. It may ask as a short note in the university exam. Okay. There are there are two pleural sacs, one on each side of the mediastinum. Here there is a mediastinum enclosing the heart. Lung. This is the lung in the early stages of the development. Lung invaginate the pleural sac. This is the pleural sac. Pleural sac has two layers or coverings. Outer one is known as parietal pleura. Inner one, which is adherent to the lung or inseparable from the lung, is known as visceral pleura. The potential space between parietal pleura and the visceral pleura is known as pleural cavity. This cavity is the pleural cavity. This one is the trachea, divides into bronchus. There is a table showing the comparison between visceral pleura or the parietal pleura. Visceral pleura is also known as pulmonary pleura as it is adherent to the lung. Visceral pleura develops from the splanchno-pleuric mesoderm. Parietal pleura develops from somatopleuric mesoderm. Position. The visceral pleura lines the surfaces of the lung, including the fissures of the lung. It covers the surfaces and fissures of the lung, and the parietal pleura lines the thoracic wall, mediastinum, and the diaphragm. Then the nerve supply. The visceral pleura is supplied by sympathetic nerve, which are second to fifth thoracic ganglia. The parasympathetic nerves are from the vagus. The thoracic nerves, sympathetic, are supplied by parietal pleura. Sympathetic nerves are the thoracic nerve, and the parasympathetic are the phrenic nerve. The sensitivity. Visceral pleura is insensitive to pain, and the parietal pleura are very sensitive to the pain. The pain of the pleura is referred to the different part of the body. Then the blood supply. Visceral pleura is supplied by bronchial vessels, and the parietal pleura is supplied by intercostal and pericardiophonic vessels. The lymphatic drainage. Visceral pleura drains into the tracheobronchial lymph nodes, and the parietal pleura drains into the intercostal lymph nodes. Then the pulmonary pleura or the visceral pleura. This is the parietal pleura as a half cone. Okay. Then pulmonary pleura cover the surfaces and fissures of the lung. It is firmly adherent to the lung and cannot be separated from it. Then the parietal pleura is thicker than the pulmonary pleura and is subdivided into four parts. These are costal pleura. This is the costal pleura along the inner side of the rib or thoracic cage. And this one is the diaphragmatic pleura on the inferior surface of the lung just above the diaphragm, known as diaphragmatic pleura. This is on the mediastinal surface of the lung, covers the mediastinal surface, that is the mediastinal pleura, and just above the first rib, which covers the apex of the lung, is the cervical pleura. These are the subdivisions of the parietal pleura. Number one is the costal pleura, then the inferior one is the diaphragmatic pleura, medial one is the mediastinal pleura, upper one is the cervical pleura. These are the subdivisions of the parietal pleura. Then what is pulmonary ligament? Then the parietal pleura, this one is the parietal pleura. This is the root of the lung. Root of the lung is having pulmonary artery, pulmonary veins, and the bronchus. This is the root of the lung. The parietal pleura, covering the root of the lung, extends downward beyond the root as a fold known as pulmonary ligament. This one is the extension of the parietal pleura beyond the root known as pulmonary ligament. Then the recesses of the pleura. There are two recesses of the parietal pleura which acts as a reservoir space for the lung to expand during deep inspiration. These are costomediastinal recess which lies anteriorly, particularly in relation to the cardiac notch of the left lung. This is the costomediastinal recess. This is the cardiac notch of the left lung. Another is the costodiaphragmatic recess or costovertebral recess which lies inferiorly between costal and diaphragmatic pleura. This one is the costal pleura, this one is the diaphragmatic pleura. This recess is the costodiaphragmatic recess. This recess is the costodiaphragmatic recess, or this is from the behind. Pleural reflections from the behind. These are the thoracic vertebra. This is the diaphragmatic pleura. This recess is the costovertebral recess or costovertebral angles. These are the two recesses. One is the costomediastinal recess, another is the costodiaphragmatic recess. Then the nerve supply. This nerve supply is the important. Parietal pleura is supplied by somatic nerves. Costal and the peripheral part of the diaphragmatic pleura are supplied by intercostal nerves, and the mediastinal pleura and the central part of the diaphragmatic pleura are supplied by phrenic nerves. Root value is C4. The pulmonary pleura or visceral pleura is supplied by autonomic nerves. The sympathetic nerves are second to fifth sympathetic ganglia or T2 to T5 sympathetic ganglia, and the parasympathetic are supplied by the vagus nerve. The sympathetic dilates the bronchi and the parasympathetic constricts the bronchi or narrows the bronchial tree and also secretory to the gland. Then the blood supply and the lymphatic drainage. Parietal pleura is supplied by intercostal, internal thoracic and the musculophrenic arteries and drains into azygous vein and the internal thoracic vein. Lymphatic drain into the intercostal, intermammary and the posterior mediastinal and the diaphragmatic lymph nodes. Then the pulmonary pleura or visceral pleura, like lung, is supplied by the bronchial arteries and venous drainage drains into the bronchial veins, and lymphatic drains into the bronchopulmonary lymph node. These bronchopulmonary lymph nodes are the important. Then the clinical anatomy or applied anatomy. Aspiration of the fluid from the pleural cavity. This cavity, pink one is the pleural cavity, is known as paracentesis thoracis. It is usually done in the 8th intercostal space in the mid-axillary line. The needle is passed through the lower part of the space or lower part of the intercostal space to avoid the injury to the neurovascular bundle, that is the vein, artery and the nerve. This is the aspiration of the aspiration needle or aspiration of the fluid from the pleural cavity, that is known as paracentesis thoracis. Then the pleura extends beyond the thoracic cage at 5 places. These are right xiphicostal angle, right and left costovertebral angles on the posterior aspect, right and left side of the root of the neck as a cervical dome of the pleura above the apices of the lung. At these 5 places, pleura extends beyond the thoracic cage, and these places may be injured, or these sites are the vulnerable sites, are carefully uh, Costal and the parietal parts of the diaphragmatic pleura are innervated by intercostal nerves. The pain of the right shoulder occurs due to inflammation of gallbladder, and pain on the left shoulder is due to splenic rupture. This is the cervical pleura. This one is the costal pleura. Part of the parietal pleura which are innervated by the intercostal nerves. This inner one black line is the visceral pleura, is innervated by the autonomic nerve. Is the mediastinal part and central part of the diaphragmatic part of the parietal pleura which are innervated by the phrenic nerves. This is the heart. This is one is the arch of aorta. This is the diaphragm. This one is the thoracic cage. Parietal pleura limits the expansion of the lung. Visceral pleura behaves in the same way as the lung. Parietal pleura has same nerve supply and the blood supply as the thoracic wall, and the pleural cavity normally contains the minimal serous fluid for lubrication during the movement of the thoracic cage. Pleural effusion is one of the signs of the TB or tuberculosis of the lung. Thank you. Thanks for watching.